Hi guys, I'm Surya Satish, a third year student studying at IIVER. Today we'll be talking about zoonotic diseases. So without any further ado, let's get straight into it. So what is zoonotic diseases? So zoonotic diseases are illnesses that pass on from animals to humans, or in some cases from humans to animals. Around over 200 known zoonotic diseases exist, and they are rare and easily preventable. The key is knowing which ones are common in India and how they actually spread. Vets, by the way, act as the frontline defense against zoonotic diseases, which is something very few people know. Vets, they don't just protect animals, they protect humans as well. And this concept is called One Health. The idea that animal health, human health, and environmental health are all interconnected. So first up, we'll discuss about rabies. You've probably heard about rabies, but the statistics in India are still alarming. India accounts for 36% of global rabies death, almost all of them from dog bites. How it spreads to humans is through a bite or a scratch from an infected animal, primarily from street dogs, but cats, bats, and other mammals can also act as sources of infection. The virus travels through your nerves to your brains. What you must do within the first hours is wash the wound with soap and running water for at least 15 minutes and go to a hospital immediately. Do not wait for symptoms to show, because in the case of rabies, once symptoms show, it's almost always fatal. The post-exposure prophylaxis vaccine series must be started ASAP. So how can you prevent it? Make sure to vaccinate your dogs and cats against rabies, and also try to avoid approaching street animals or animals that you're not familiar with. Also educate your children to do the same and not to approach animals that they are not familiar with. Next up, brucellosis. Now, brucellosis is one of the most common zoonotic diseases amongst animals in India. However, a lot of people have never even heard of the disease. It primarily spreads via contact with infected birth materials like aborted fetus or reproductive fluids. Drinking raw unpasteurized milk or consuming unpasteurized dairy products can also cause infection. In humans, symptoms include recurring fever, joint pain, fatigue, and sweating. And the disease is often misdiagnosed as general fever or malaria even. Prevention is primarily vaccination. Vaccinate cattle and goats against brucellosis. Always wear gloves when assisting animal births and never drink raw milk. And farmers, always make sure to wash our hands thoroughly after handling animals, especially around birth. Third is leptospirosis. Leptospirosis is particularly dangerous in India during and after monsoon season. It comes from an unexpected source, that is primarily rat urine in flood water. It spreads via contact with contaminated water, soil, or mud, which usually enters the body through abrasions on the skin, eyes, nose, or mouth. Symptoms in humans are initially flu-like, fever, headache, muscle pain, and they can progress to kidney or liver failure, bleeding, and meningitis in severe cases. Prevention is primarily avoid walking barefoot in flooded areas, wear rubber boots on farms, vaccinate your dogs against leptospirosis. It's included in the standard DHPPIL vaccine, control rat populations around farms and homes, vaccinate livestock in endemic areas. Disease 4, Toxoplasmosis. Toxoplasmosis is caused by a parasite, and it's cats that are Toxoplasmosis is caused by a parasite, and cats are its primary host. For most healthy adults, it causes mild or no symptoms, but for one group, it is extremely dangerous. Pregnant women. How it spreads? It spreads via contact with infected cat feces, primarily when cleaning litter boxes. Eating undercooked meat from infected animals also serves as a source of infection. In pregnancy, it can cause serious birth defects or miscarriages if the mother is infected for the first time during pregnancy. Prevention. Pregnant women should not clean litter boxes. Have someone else do it for you. If you must, wear gloves and wash hands thoroughly. Keep cats indoor to reduce their exposure to the parasite, and cook meat to safe temperatures. It's important to know that owning a cat does not automatically put you at risk of the disease. Good hygiene eliminates most of the risk. Last but not least, ringworm. And despite its name, ringworm is not actually a worm. It's a fungal infection, and it's most commonly transmitted skin condition between pets and their owners, especially in children. It spreads via direct contact with an infected animal's skin or fur, contact with bedding or objects the animal has touched. Circular, scaly, hairless patches on the skin, often on the head, ears, or forelimb, are the major sign of this disease. In humans also, you can see circular, red, itchy, ring-shaped rashes on the skin. Treatment is antifungal creams for both the pet and the owner. Both of them must be treated simultaneously to prevent reinfection, so make sure your vet and your doctor are kept in loop. So if you learned something new in this video, make sure to subscribe and see you in the next video. Bye bye.